Hi everyone, and welcome to my week 7 synthesis video. Before I dig into the bullet points and the discussion topic, I just wanted to speak for a moment about Dr. Wayne Dyer. He was a motivational speaker for many, many years that I used to listen to all the time, and he said something that always stuck with me. When you wake up in the morning, are you saying, "Oh God, it's morning," or "Good morning, God"? And that kind of resonated this week as we learned more about positive affect. Okay, so what are some of the common themes across the assigned readings? I think that the common themes are really all about mental health during times of extreme stress or transition. So for example, we looked at pregnancy and graduate school, and also, let me go back for a second, postpartum, and that article about pregnancy and mental health, it also went into that postpartum time quite in depth. To me, that's really important. I wrote a book. I'm looking to the side. There you go. I've written 2 books, but one of the books that I've written is about pregnancy and yoga and fitness specifically. And mental health is so important during that time when your hormones are fluctuating so dramatically. It is common to have very high highs and very low lows. Interestingly enough, that happens again during perimenopause and menopause in a slightly different way. Less estrogen, obviously. So I really liked the way that the literature dug into, there are these major transitions in life that from the outside should be really, really hopeful and positive and joyous, and like what could be better than becoming a mother. But at the same time, we need to consider the physiological changes that are happening inside and how that can trigger certain moods, and it's totally normal. And finding strategies to feel good again, whether that's talk therapy or balancing hormones, or when necessary, perhaps looking towards some kind of mood stabilizer. All right, what are your perceptions of the behavior change session this week? My son is doing such a good job. I'm gonna just brag for a moment as a mom. I think that it's really, really, really sweet when you can cultivate particular practices like meditation with little ones with him from the time that he was in my belly. I teach yoga, and so when I was meditating during my pregnancy, I was always sending him love and compassion. And then I taught Mommy and Me yoga with him, like in a baby Bjorn. He was always right here. So meditation has been sort of the norm for him, if you will, since forever, since he's been in existence. So to see him cultivate this practice on his own was just really, really cool. And it makes me feel very satisfied that he has tools for stress. What are the implications for your personal and or professional work? Again, going back to what I do, I'm really, really passionate about working with women's health, especially during impactful transitions such as marriage, divorce, pregnancy, new motherhood, perimenopause, menopause, the list goes on. Anytime there is a major transition, I feel like we can all use support. And my area of expertise happens to be with women and making sure that the nutrition and the hormones are being taken care of and addressed. And then also moving your body and lifting your arms and opening your heart and going for walks and doing all the things that we know can help. When we are sitting and slumping and kind of caving in on ourselves, it would make sense that the feelings would kind of do that as well, to kind of drop. So I think that we need to look at the physical affect and how there's a link between that positive affect mentally and the physical affect as well. How can positive affect impact health? When we have that, that positivity and that feeling of joy and being lifted, our mood is lifted, our outlook on life is lifted. So of course that's going to impact our health. We're going to experience the cascade of, I think Deepak Chopra calls the body's inner pharmacy. So imagine if you're setting off a cascade of like oxytocin and like all of the feel-good stuff that can happen in your body, that's going to have an effect cellularly as well. We can get into parasympathetic states. We can get into rest, restore, and recover, and not always live in that like heightened sense of fight or flight, which we know can lead to tremendous stress on the body. And it's so frustrating, and I'm sure that some of you feel this as well, when you know how easy it can be to help people help themselves. Like, let's just get up, let's move, let's talk, let's do all the things. And I feel like sometimes it's kind of lost in a sea of commercials about here's this drug for this and that drug for that. I want to be really clear. I'm not saying that pharmaceuticals do not have their place. I really believe that they do. But what can we do before we hit that? We've got exercise, we've got nutrition, we've got all these different ways to feel better. We had that whole list from Dr. Alexander last week, which I think was from Matt Buns, with meditation and walking a dog and sunrise, and there's just so much that we can do. It's inspiring. How can we reduce stress? Do we need to? Yes, we do. So parasympathetic nervous system, rest, restore, recover. It's also when we can reproduce. When we are in that sympathetic fight, flight, or freeze, the body doesn't like think, oh, we need to ovulate now. No, it's not thinking about making babies. It's thinking about, do I stay and fight, or do I hightail it out of here? So I think as a society, during COVID and all of the political unrest that ensued during 2020 and 2021 especially, we all kind of lived with that low level sympathetic nervous system stress going on, almost like, do you remember when we used to turn the TV on and you would just hear, and there was like the fuzz, like the poltergeist screen? It felt kind of like that. There was this background feedback of just low level or high level stress all of the time. So it feels like we've had a moment to breathe, and I hope we continue that, although watching the news can scare me. Okay, what role does stress play in our overall health, and how does it impact performance? Stress can lead to a host of physical maladies. It can affect pretty much any system in the body. Gastrointestinal, especially, has been something I've seen a lot in my personal clients. I see a lot of like IBS, and I call it stress belly, where they just hold it all in their tummy. And when we start to release and breathe and get into that kind of feeling so that they can rest and digest, things get better. How does it impact performance? Let's just go with that same example. Let's imagine if your gut is distended, if you are inflamed, if you are bloated, how the heck are you supposed to perform? Whether that's mentally or physically, whether you're an athlete or a mom or an executive, walking around with that is just really, really hard, and it makes it hard to get anything done. So I'm very thankful for all of the readings this week. They were especially impactful in terms of what I do. Again, working with women, empowering women, especially through times of transition. Have a great week.